As we mentioned last week, we officially announced that the fourth wave of the pandemic, unfortunately, is here, and cases increased dramatically since the first three waves. From March 2020 to July of 2021, so almost a year and a half, there was 134 cases, and since mid-July till now, we have 63 cases. So we're almost in 6 weeks. We're almost half of what we've seen, throughout the entire pandemic. We don't have all the data yet on if they're all Delta variant, but we know that the majority of them were Delta variants, and we kind of suspected that because of how transmissible it was and how fast it spread, but that was confirmed through the labs. And then for the rest of the cases, we haven't had that confirmation yet, but again, it's suspected. We had 2 cases so far that were fully vaccinated who got COVID. So that is that possibility of those breakthrough cases. That's not 100% unexpected. It is unfortunate. Having been fully vaccinated, is still the primary goal to get us through this pandemic. But there are people who have immunocompromised individuals or people with other diseases who are the vaccine and their body's immune response is not as strong as others, so they are still susceptible to breakthrough cases. And as you may have just recently known, that Quebec, through public health, has recently recommended that a third vaccine be issued to people who are immunocompromised. So that's something that public health will be looking at very closely, and we'll get more information to the community on that. So it's again additional means to ensure that people are properly protected. As you may recall, we did do a press release on going back to August 13th. We mentioned that the proof of vaccination will apply in the community across the board for everybody. The goal was September 1st. Since that time, a lot of things have transpired. There was some concerns raised by community members. There was concerns raised by the elected council, and concerns raised by the Longhouse, and so we had to take a step back and look at this a little more closely. There was a series of discussions that took place with council over a period of the past couple of weeks. They provided their perspective and some of the concerns that they are hearing, and again, it was looked at and from all angles. But at the end of the day, it was felt that this measure is still extremely important as one piece of the puzzle to keep our community safe, to keep the economics in our community going, keep people employed, keep a safe environment in some of these high-risk areas. And it's something that unfortunately needs to take place, and this was supported by Chief and Council. There's discussions about that's at the employee-employer relationship, like through KSCS, MCK, and KMHC, for example. They have that ability on their own to make those decisions. That won't come from myself or public safety to implement mandatory vaccinations, but an employer has their rights to or their ability to take decisions onto their own on that one. We understand it's a controversial topic, but at the end of the day, it's purely a health measure. It's not about politics. It's not about jurisdiction. It's not about we're doing this because Quebec is doing this. We're doing this because it's the right thing to do. Kahnawake had the choice. We could have chose not to do it, but there's consequences to that, and the consequences are something that I'm not prepared to subject our community to. Easier transmittable, equals more cases. Again, more people getting sick, higher risk of death in our community. And this we find is a good balance between ensuring the economics continue in a safe way, so we don't have to consider locking down everything.